the spotlight. In the spotlight.
Greetings and welcome to In the Spotlight. This is our podcast series where we speak with healthcare professionals who are driving transformative change here in Southern California and throughout the country. I'm Adam Blackstone with the Hospital Association of Southern California. And today we are very honored to have Jerry Blass with us. Jerry is the president and CEO of Comply Assistant. Jerry, good morning and thank you for joining us. Welcome.
Good morning, Adam. Thank you.
Well, to kick things off, I was hoping that you might be able to tell us a little bit about your role and your journey in the governance, risk, and compliance technology space.
Sure. So I've been in healthcare IT for many years, and towards the end of the 1990s is when, of course, we experienced Y2K, and I worked in a large medical center in New Jersey, and I was put in charge of Y2K. It was probably one of the best experiences as far as from an enterprise perspective of impacting the entire organization and how to project manage that. And then that led into being put in charge of HIPAA security, and I became an ISO, which is like a CISO today. And so over the years, I've been able to experience a lot of change in healthcare in relation to IT, in relation to privacy and security, how those risks have increased, and how we have had to keep up with that with what we offered. So I started Comply Assistant back in 2002. So been involved in it for 23 years now. And of course, there's been so much change and need to evolve on both sides, on our side and on the healthcare organizational side.
Yeah, thanks for that. I know we're going to be getting into sort of how things have evolved a little bit later, and I don't want to get too far ahead. But I do want to ask if, some of those listening might not be too familiar. Just want to see if you can give us a brief overview of what Comply Assistant does and how it safeguards our hospitals from risk.
Great. So we provide what we call vCISO service offerings. What that really means is that when we meet with a hospital for the first time as a prospect, let's say, we do a discovery of where is their pain factor when it comes to addressing risk. Is it with third-party security risk management? Is it other areas that perhaps due to budget constraints, they're not able to address on their own? So that's the first part of it, is to understand, because every healthcare organization has things in place, controls in place. Every healthcare organization understands that they need to do things. So the problem comes in is when they can't do everything they need to do. We identify that and we help them. Once we understand that and begin to help them, we offer our governance, risk, and compliance platform as a means to document their due diligence, their roadmap for mitigation of risk, and that becomes their management tool to keep them on track and to be able to, if there's an incident, to be able to survive a review by the government, by the OCR. They'll come in and see that they are demonstrating due diligence. So from a compliance standpoint, they are not negligent. So our total offering is called GRC, Governance, Risk, and Compliance. And it does involve software, and it does involve our subject matter expertise.
Great. Thank you for that. And I was doing a little bit of research prior to this conversation, and I was maybe not so shocked to find out that the average cost of a healthcare data breach in 2024 was roughly $9.8 million, which is the highest among all industries. So that just illustrates the importance of the services you all provide.
Mhm.
Curious, Why such a high cost per incident?
Well, the complexity of healthcare, the value of their data, the extended downtimes that have occurred that cause major disruption. Um, that alone being down for potentially months causes diversion of ambulances, diversion of chemo, dialysis, maybe medical devices are down, so it impacts the ICU. Um, Certainly cash flow because they can't bill claims manually, so they can't bill claims. The impacts are tremendous, could be very tremendous from an organizational impact standpoint. The ransomware that is requested because of the value of the data from a clinical and financial, uh, confidentiality standpoint. And again, the disruption causes the hospitals, healthcare organizations to want to pay that ransomware quickly and get back up. And then if there is negligence, which unfortunately for a lot of healthcare organizations with their budgetary constraints, uh, again, as I mentioned before, how we can help them. But if they demonstrate any kind of negligence, that could lead to attorney general or class action lawsuits or penalties. And so the combination of all of that comes into play in healthcare because of the complexity, the interconnectability, the interoperability. Um, it's just, the sky can become the limit when it comes to the cost. And I just read today that Change Healthcare, the count of individuals impacted by the Change Healthcare ransomware attack is now 190 million
Wow.
patients.
Yeah, and that was just February of 2024 when that occurred.
Mm-hmm.
You talked about the numbers, which are quantifiable, and we're still figuring out the impact. But the part that's not quite as quantifiable is what you mentioned earlier, which is the disruption of care, the lack of access to vital services that hospitals provide and other healthcare organizations, life-saving treatments, right?
Mm-hmm.
So there's a human cost involved as well. This is not just a financial impact to a hospital. This is a community impact on
Mm-hmm.
multiple levels, right?
Yep, absolutely. There's also potential for reputational harm as well. Um, and that could have, an effect over time.
Sure.
Eventually could be repaired, but it's never good.
Yeah, I mean, as a just as a community member, you put your trust in a healthcare care organization. It's probably not on the forefront of everyone's mind that their vital information could be obtained by bad actors that
Mm-hmm.
are going to leverage it for financial payday.
Mm-hmm. That's correct.
So we talked about you mentioned Y2K. So I know your organization has existed for more than 20 years, and a lot has changed, right? It sounds like from the days of Y2K to where we're at now, there's been quite a bit of evolution. Just wanted to ask how that change has looked for you as a company and how you stay ahead of that technological curve.
Yeah, great question. So in the beginning, back in the early, well, 2003, 2004 is when HIPAA went into effect. And, when I look back on that, the main thing there was more about insider problems, okay, with either individuals or employees snooping records, maybe a VIP or celebrity, some kind. In some cases, they began to sell information, like Arthur Ashe's. He was a great tennis player. His information about his condition was sold to the National Enquirer. So folks began to understand that they could make money off of breaches, even to the point where employees in emergency departments would sell charts to lawyers of accident victims, so the lawyers could then go after to try to help the victims. But of course, that was they were making money doing that, and it was illegal. But as we advanced through the years, um, that's what we were dealing with as a company in the first decade of the 2000s was breaches that were less impactful, but still breaches, still require training for employees, policies and procedures, but maybe in looking at it, well, absolutely in looking at it the way it is today, much less impactful. As soon as meaningful use came around on the Affordable Care Act in 2010, the digitization of information, electronic medical records, transitioned so much information from hard copy to electronic that the attackers knew now there's a whole bunch of fish in that ocean to go after. And that in those 5 years or so of the initial meaningful use program, the focus was not necessarily on the security aspects, even though there was a security checklist based on the HIPAA security rule. But it was a checklist. And so there was a lot of vulnerabilities in the initial migration. And that's where the cybersecurity attacks really began, right around 2015. And so we had to then adjust to being able to provide more in our software, more in our services around protection. Over time, it's really a numbers game. How many locations of protected health information are there, and how do they keep increasing over time? Now with AI, we have these large language models that they're training that could contain PHI. It could be bias, it could be hallucinations in today's world. So we have to keep adjusting to the environment as we go. And at the same time, we do listen to our clients. We listen to our own consultants who are using our software to do work. We get feedback from many different areas, and we listen from a software enhancement standpoint to make improvements to better, address the current world of what's needed. So that's how we have managed to adapt our software and our services over time based on, the increases in impact of what's going on. And, the government formed CISA or CSA, the Cybersecurity Act in 2015. They came out with HICP, which is the Health Industry Cybersecurity Practices. That's been in effect since 2021. That's another area that we had to adjust to. This year, it's going to be the HIPAA security rule that's going to get updated with cyber security content controls that must be met by healthcare organizations. Internationally, we're getting involved there because those governments are now mandating from a cybersecurity standpoint to have compliance from organizations in Europe and around the world. So that's where ISO comes into play, the international standards, GDPR, which is the big privacy rule over in Europe. So the world is, our area of concern is now the entire world, including healthcare in the U.S. And multiple verticals. Cybersecurity doesn't care what type of organization you are. They know there's vulnerabilities, they're going to attack it. So we're getting more and more involved in other verticals as well besides healthcare.
Wow. So it sounds like you've been kept on your toes for the last couple decades, trying to keep
Hmm.
up and doing a great job of it. You did mention a
Thank you.
topic that is of a lot of concern. It's a hot topic, and it was in my notes to bring up at some point, but you did mention AI. Obviously, it has, in the past couple of years with ChatGPT and other platforms, been a big topic of discussion. Can you talk about the roles, that it might play to aid in safeguarding hospitals, but then
Mhm.
also conversely, what we might need to be concerned with in terms of how it could threaten hospitals?
Okay, another great question. So AI gives an advantage to internal security folks in a hospital. How does it do that? Well, if you have an AI-enabled breach monitoring, detection, and response system, AI can now discover anomalies on networks a lot faster due to the technology. It can provide alerts to key people quickly, and it can also aid in the response to the incident. So that's pretty dramatic because folks used to, uh, security individuals used to determine, even maybe 5 years ago, that someone was on their network for 250 days. An attacker set the stage and was actually there, without being known. So today they're known immediately due to AI, and that helps in reducing the potential impact of what could be caused over a long period of time compared to an immediate notification. That's big time. The bad guys are using AI to do things like make phishing more realistic, uh, giving more temptation for employees to click on an email because it looks more genuine. They even could have images and voices that sound like a CEO or a COO, CFO. So they really believe this is the person. In fact, there was an individual in an organization in Hong Kong who uh, thought he was on a Zoom meeting with the CEO, the CFO, and the COO. And they instructed him, he was in finance, they instructed him to transfer 25 million plus to another organization. And he did it only to realize after the fact that it was not them.
Wow.
Yeah. So that's called a deep fake. And that's what we're seeing as well. So, yeah, the bad guys are definitely using AI to maybe even find gaps where they can get into a network more quickly. And it is definitely a two-sided coin, helping both sides, the good guys and the bad guys. From a leadership standpoint, that there needs to be governance, obviously, over cybersecurity and also now over AI, because as hospitals introduce AI-enabled products, apps into their organization, the third-party vendors that are providing those apps need to be vetted more than just from a cybersecurity standpoint. They need to be vetted on how do they understand that there needs to be integrity in those training models, in the data that is being used to make decisions. Can't be biases in there. There shouldn't be hallucinations in there. What do they do to prevent bias and hallucinations? Keep the
And Jerry,
integrity.
I don't mean to interrupt.
Yep.
Can you explain hallucinations?
Well, hallucination is when it's like garbage in, garbage out. Okay. If a model that is being used for some application in healthcare, um, maybe radiology, maybe some other clinical or nursing, EMR. If there's bad data in the model of data that could be impacted by it could be impacted by a bad guy actually getting access to that data and introducing, either malware or inaccurate data in there. So imagine getting outcomes from AI that have been, in a sense, uh, you know, made not totally valid, hallucinational. And the hospitals in those use cases are going to be relying on the results from the AI model to provide the right protocols and the right treatment for patients. So this is now potentially impacting patient safety and lives. Okay, so it's definitely a concern. Um, it can never be 100% relied upon. It's probably 80% at best. There always has to be, especially with critical clinical applications, 20% human review before something is considered to have integrity. So the key is it all goes back to governance. There has to be a governance committee over the apps that are in place. What are they used for? How are the vendors providing verification around biases and hallucinations and how they avoid that How are they protecting that data from a cybersecurity standpoint? Everything is all interrelated now, and it's complex.
Yeah, it certainly is. And going back to the deep fake example that you provided in Hong
Hmm.
Kong, it seems as though in that case, clearly it was sophisticated technology that led to somebody um, uh, being so vulnerable as to give, you mentioned that huge figure that was provided, but it
Hmm.
seems as though change in human behavior is maybe some of the more simplistic um, reactions to those types of potential threats might be
Hmm.
necessary, right? Because if I receive a request like that, at least for myself, for any dollar amount, it would be to verify on maybe a couple different levels, right?
Hmm.
So
Yeah.
maybe a low tech response to a high tech threat.
Well, it certainly comes back to policy. If certain levels seem unreasonable on requests like that, uh, everyone should be trained on what those levels are to take an extra step of verification. But the interesting part here is that I mentioned that in the beginning of all this, most of the risk was internal from internal employees, right? And that's why training was so important. Um, that's kind of come full circle now, where because of phishing, insiders are still the biggest threat almost when it comes to letting malware into a network that could bring a complete network down. Um, and that comes from someone clicking on an email. So that's again where training comes in. There's excellent apps out there for training on phishing. So it's important that the internal risk that could be the weakest link in all the controls that are in place to protect against cyber is addressed with exactly what you said. It's the human factor of understanding where something might seem a little bit off and to take an extra step to verify, especially if it seems unreasonable.
Yeah, if it's millions of dollars, I recall a
Mhm.
couple of years ago, I received a text claiming to be the CEO of our organization asking for Target gift cards. So
Mhm.
on a much different level. But
Right.
after
Yeah.
verifying it, we determined it was not from our CEO, and I
Hmm.
think it was a $20 gift card. So in this case, not hundreds of millions of dollars, but nonetheless
Hmm.
still an attempt.
Hmm.
Uh, and so yeah, I think to your point, having the policies in place, right? The make sure that the human factor is not overlooked when talking
Hmm.
about these really high tech solutions.
Exactly.
And you mentioned earlier in our conversation, maybe 2015 is where things really kind of took off. I was looking at
Hmm.
some statistics, and between 2018 and September of 2023, there was a 278% increase in ransomware attacks targeting
Hmm.
healthcare organizations. Given what we talked about, I can kind of extrapolate what that dramatic jump might be attributed to, but
Hmm.
would you like to expand on that a little bit?
Well, it's interesting that right in the middle of that time frame is the pandemic, and that caused disruption of the workforce as far as they had to dig into many different areas of helping out which was not directly related to their job. Even CISOs had to get involved in the vaccine process, and a lot of remote workstations was set up in that time frame. So more locations of vulnerabilities with a lot of folks working remote. Um, so that was smack right in the middle of that time frame. I'm sure that has something to do with it, and really no doubt about that. But again, it also does go back to all of the reasons why healthcare um, has been considered, a prime area to attack based on the data, based on the continual locations of um, electronic information, based on the amount of money that the attackers can get. because hospitals don't want to be disrupted. They have too much complexity of everything they have to do every day, and that disruption is amazing that they don't want to be down for a long period of time, even though that does occur. Um, Lack of cybersecurity resources, that does go back to the time frame again, related to the pandemic, right?
Mhm.
The resources were, you know, doing other things at the time and distracted by other things related to the pandemic. Um, so even the medical equipment is another, area of vulnerability that attackers know about. Um, and all of it has been increasing. There's been more and more medical equipment put on the network, so that they become part of the attack vector. And some of the medical equipment is perhaps older technology that has not been updated in a while. And from a security standpoint, maybe have not been updated in a while, mainly because of the hard-coded nature of a medical device. So attackers know that they can go after those devices potentially and find security loopholes related to that type of equipment, and now it's on the network. So all of that has been happening throughout that time frame as well. So this it's really hard to put your finger on like one thing,
Mhm.
but it's going to continue. There's no doubt about it with this AI, uh, you know, increasing tremendously, and technology, all the time. Change management, organizational changes, mergers and acquisitions, conversions to other EMRs. There's just so much that goes on in that vertical that the attackers know the folks that are trying to control everything are really, really trying to keep their head above water. And on top of that, we mentioned budget constraints. During the pandemic and afterwards, nursing, they were burnt out, some retired. So a lot of them became agency nurses or contracted. They left the healthcare organization and became more expensive. And healthcare organizations had to spend a lot more money on nursing that impacted their bottom line to be able to spend more on controls. How do they make those decisions on where to spend the money, especially when the nursing part of it was outside of their control. So it's just a lot of obstacles to overcome. And, hopefully will continue to help the good guys even more and more so that it'll help them with everything they're dealing with every day.
Yeah, it's disheartening to hear about the fact that the pandemic was a point of vulnerability when healthcare organizations were more important than ever, right?
Oh,
We
right. That's
we
right.
know the strain that they were under, and to know that some bad actors were looking at that as an opportunity. We just
Right.
had wildfires in Southern California, which was another reminder of what disasters could look like, man-made or not.
Mm,
While our hospitals have multiple competing priorities, but number one, taking care of the communities that they serve, that they've also got to look, peripherally at all these other uh, moving parts, right? Because hospitals are
hmm
complex ecosystems. So having your organization being able to guide and help them must be a tremendous reassurance for them, right?
hmm And I can say too, Adam, that uh, like you mentioned the wildfires, and you're close to you live there. I don't mean you lived in a fire, but you live in California, and you're part of HASC, which is Southern California. Um, Whether it's a natural type of disaster or a cybersecurity type of disaster, the other important thing to keep in mind here is business continuity plans for healthcare organizations have to be updated, not only for the potential of the amount of time that an organization could be down, which maybe used to be 3 days, now it could be 3 months. There's a lot more impact. It's just geometric. And that can occur from a cyber ransomware attack or fires or hurricanes, so from many different angles, healthcare organizations need to, if they haven't done so already, update their business continuity plans so that it becomes a playbook, do tabletop exercises, so that not if, but usually it's when it happens, they'll at least have something that can make the situation more manageable without as much panic as there could be without it.
Sure. Yeah, those
Mm,
tabletop exercises and training is so important. Going through the wildfires, our hospitals did an amazing job responding,
mhm,
as they always do. But no organization is perfect or no system, and there are
mhm,
multiple moving parts in that system. Whether it's there's EMS, there's counties, there's government, there is regulatory bodies. And so you do see the gaps. And so, unfortunately, it takes situations like that sometimes to see those gaps
mhm,
that exist. But, the training and going through some of those exercises could help get ahead of those. So you don't have to wait until the next wildfire, earthquake, pandemic,
mhm,
epidemic before you start to realize some of the gaps that do exist,
mhm. And all this stuff is happening more often.
unfortunately.
Yeah. Yeah.
Yeah, you said it's not a matter of if, it's
It's
a
when.
matter of when. And we know that for certain we will have, some unfortunate events that hit our hospitals and hit communities, and we need to make sure that our community, our hospitals are fortified and
Mhm,
are safeguarded from some of these vulnerabilities. So
mhm,
that is why a service like yours is so valuable. I do want to get into, I know we're kind of closing in on the end here, but a couple more questions for you.
mhm.
You mentioned quite a few concerns, and I can imagine there are quite a few things that keep hospital leaders up at night. One of them being cybersecurity. What are you hearing from healthcare leaders across the board of what are some of those biggest pain points?
Well, I think that everyone has seen the Change Healthcare impact across the nation. And now that's saying 190 million patients were impacted. We've seen where, and healthcare leaders have seen where a ransom attack or bringing down a hospital for an extended period of time can affect patient safety and lives because of the medical devices that are down and diverting. And so cybersecurity is now not just about protecting data, but also about protecting patient safety and lives. So these healthcare leaders are going to bed every night with all these concerns that they must be thinking about. Um, and they now know that they have to become part of this governance. They have to be informed of exactly what their current state is, where their risks are, how can they address those risks? Do they have problems addressing the risks, and how can they overcome those problems? With AI, there also needs to be that governance and understanding, like I said before, how it's being used, how it's being vetted, so that you're not going to get some kind of a bad result from bad information. Um, you know, the complexity of everything today has the leaders really, really more involved with the governance side of it, the understanding of their organization's current state. And it's got to be very tough across the board, from top to the bottom, to be able to say, well, is today going to be the day that we get it, that we get attacked, or we have some kind of a big problem? Um, the when, not if, is today the day for us? And I believe that the concept of if there is an incident, that organization um, should be shamed. It used to be the HHS Wall of Shame, which may still be there from the old days, the Wall of Shame. Well, if an organization is trying their best to implement controls and have oversight around these problems, and we know that so many organizations and so many great organizations that have done a great job around implementing controls to reduce risk still get attacked, still are down. You know, I think we're going to get away from the shame factor and more about what can we do to help so it doesn't happen if possible. So that's and healthcare leaders, I think, understand that concept as well. They need to know that though their team is on the same page and everybody's moving in the right direction to try to prevent an incident from happening. Now, of course, the wildfires, something like that, is not due to implementing controls within a hospital organization necessarily, an individual hospital. Maybe there are some other controls around wildfires, but that is also an area where healthcare leaders have to be worried about, natural events as well. So the pressure must be amazing on the leadership and really on everybody.
Yeah, I mentioned before the priorities of caring for a community. One often doesn't think of the complexities that are involved with running such an organization like a hospital, and all of the multiple factors that must be managed. And there are typically they're big employers, but you can have a lot of people who are caring for patients, but we do need professionals like yourself who are experts in this field, and really overseeing some of these organizations.
Mhm.
Finally, I want to make sure we didn't leave anything out. So before I ask the last question, is there anything else that you would like to share with some of our listeners today?
Well, I just want to say that again, with everything we talked about, our company's goal is to find the area of gap and risk because every healthcare organization has a program in place, has vendors in place, controls in place. But with all the constraints budget-wise, uh, our goal is to reduce the pain of trying to get something done that's going to reduce the risk of something that could be very vulnerable. And it could be third-party risk management. It's a very high volume, a lot of vendors, a lot of now AI-enabled vendors. How do you wrap your arms around 100 plus 500 vendors that need to be vetted without some kind of automation and without some kind of help? That's just one example. That's one of the most common examples of how we help. Um, and so I really wanted to make sure that everyone understands our goal, which is we're not just going to come in and do um, certain work that is already under control or try to advise that kind of thing. If it's under control, it's under control. So that's the first thing we determine. And whatever is not under control because of whatever reason, that's where we offer our help. And then we document it all in our platform for due diligence, evidence, and compliance. So,
Thank you, Jerry. Last question,
okay.
simple one. What's next for a Comply Assistant?
Well, we are looking to, we have a roadmap for introducing some AI into our app, which I won't get into details over, but it does help with certain things that are routine in our app that currently manual, routine, that AI can come into play with perhaps reviewing documentation like policies and making, recommendations around what could be potential gaps there that could introduce risk, as opposed to having a subject matter expert do 100% of the review of a policy. Maybe AI does 80%, and then our subject matter expert does 20, or the hospital does 20. So, wherever we can introduce efficiencies in our platform, that's one of our goals for 2025 at this point.
Awesome.
Yeah.
Well, Jerry, it's been a pleasure speaking with you today. I know I learned a
Thank
lot.
you, Adam.
Very interesting conversation. We could probably keep going on, but for the
Yeah.
sake of this podcast, we'll keep it a little bit more brief. But on behalf of our members, our listeners, thank you so much for the incredible work that you and your team do, and for continuing to educate us, not only about the history and benefits of your organization, but the industry as a whole and what we could look out for, and what we might see to come. So thank you very much, Jerry.
You're welcome, Adam. Great job. And thank you very much for having me on.
In the spotlight. In the spotlight.